Hello, friends. Welcome to A Little View podcast, the podcast where the perspective may be small, but the conversations are anything but small. I'm Gwen, your podcast host, a soon-to-be dietitian, a health coach, and an advocate. This is a podcast where we talk about things that aren't talked about. We're the voice for the unrepresented. We're having empowering conversations about healing your mind, body, and soul. And we're bringing on guests to share their inspiring stories. This is A Little View podcast. And I just want to say a little disclaimer that this podcast is for educational purposes only. It is not medical advice. Always talk to a doctor about your own health journey first. And today on the podcast, we have Kelli Christensen. She is currently in school to become a PA, which if you didn't know, PA school is a very rigorous and very competitive process. So today we'll be talking about her motivation, her goals, what helped her keep going when it was hard. So I'm so excited to have Kelli on today, and I would love for her just to introduce herself more besides going to PA school.
My name's Kelli. I am from a small town in California, but I currently live in Reno, Nevada, and I went to school at the University of Nevada, Reno, where I majored in public health and a minor in substance abuse. I graduated in 2022, and currently I have been working as a medical assistant in dermatology, and I did that for about 3 years, and then I just transitioned to doing clinical trials in the same dermatology office. And I am going to be doing that until I start PA school in May. In my free time, I like to work out, go to the gym. I'm learning how to embroider, and I'm really excited to be here.
Embroidery. Wow, a girl of many talents. You not only have the smartness, you have the creativity. Okay, girl, I see you. I see you. Can you tell me again what your undergrad is in?
Yeah, it is in public health. Honestly, if you just think COVID or a lot of preventative care in talking in the medical world in hopes that patients aren't coming to us with problems that could have been prevented.
And did you know that you wanted to be a PA when you had that degree in mind? Did you know the end goal was PA?
Yes, at 17, I started working actually at our clinic in Bishop, California, and that's where I kind of learned what a PA is, the scope of practice. Going into school, I knew I wanted to do something healthcare, but I couldn't pinpoint it yet. And then after my first year, I knew I wanted to be a PA. So I started doing the prereqs and everything for that. And then the clinical hours, you have to have 2,000 hours at least of clinical hours. I did leadership and volunteer work.
And what did you volunteer at too?
I volunteered in a few areas. One was the Disability Resource Center on my campus, where I was a mentor for people who had disabilities coming in, just knowing the campus, being a friend to them. I also volunteered at the Little People of America convention. It's called the MAB Clinic, Medical Advisory Board, where we got to see patients who have skeletal dysplasia and all different types. I got to sit in for some of the doctor's appointments, which was super cool, and just learn about other types. The volunteer ranges, I've done a skin cancer screening at a baseball game, so that was super fun. So just really getting out there in the community.
And would you say when you worked at I think you said doctor's offices back in your hometown, is when that kind of sparked your interest in PA? What kind of really drew that to you?
Growing up with a mom as a nurse and then my dad as a respiratory therapist, I've always known I want to be in healthcare. And now my sister's even a nurse, so I'm surrounded by healthcare. And so I always wanted to be in healthcare. And I honestly did want to be a nurse, but talking to my mom and everything throughout the years of growing up, I knew that's not where my quality of care would come from, because most of the quality care of being a nurse is strength. While even though I do have that, my quality of care might not be the best compared to others to the patient. I want to make sure that my patient is cared for the best, as well as the safety of me and the patient. And just knowing that I wouldn't be able to do many things as a nurse. So I just wanted to do something in healthcare. And then when I started working there at the health clinic, I knew what a PA was. I learned that I could be a diagnostician as well as do small procedures, and I could have my own medical assistant, which I am now, in hopes to help me deliver that quality of care.
And when you say, going back for those who don't know, when you say you didn't want to be the quality of care of strength, what exactly does that mean?
A lot of quality care in nursing is lifting patients and getting them situated, getting them comfortable, even doing IV bags, like just small clinical skills that it would be I'm gonna learn those skills in PA school. But I also have the team behind me. That's why I'm really interested in PA, because I have the team behind me that can also do those skills to best create the quality of care of the patient. So it's like lean and support. So like I support my nurses while my nurses support me, or I support my medical assistants while they support me.
I think this is so important because we're all humans. We all need help. No one can do everything alone. So, regardless of Kelly's size, having support and a team around you makes all the difference because their strength might be in one thing, and another person, their strength might be in another. So, we all need a team of people to help us out. And would you say you having dwarfism sparked your interest in being a PA at all too, or no?
Definitely. I am from a small town. When I was born, they did not know that I was a little person, so I was shipped immediately out to a bigger hospital, and having to travel so many miles to get all my surgeries done or see doctors, I was able to really grasp that my parents had the education, because they are both in the healthcare field, that they had the education so they could get me the resources, the advocate for me in my medical needs, and just coming back knowing that not everyone is as fortunate as me having both of your parents in the medical field. I want to go back to rural communities in hopes to help them and being an advocate for the people who have a disability in a rural area that a lot of people might not know on what resources there are. We didn't know about Little People of America, and we got to learn about Little People of America in an outside city. So just bringing in those extra resources too.
So, kind of your own experiences of not having those resources you had, and then you had to go somewhere, but your family obviously was very knowledgeable. So, being that person that you kind of didn't have, would you say?
Yeah, so just, going back and helping even parents who are expecting a child with a disability, just to show them that there's so many resources, there's so much support within the healthcare field.
And I should have probably asked this in the beginning, but what exactly is a PA? Because I've heard that basically a PA is kind of like a doctor, you just don't have as many years. But what exactly is a PA?
So a PA was made to bridge the healthcare gap. It's only 2 years of school just to push out a medical provider to help bridge those healthcare gaps. We're also trained in all specialties, so we're able to move different specialties. So if I even wake up one day and I'm like, I want to move specialties, or even the place I'm working at needs extra assistance and I choose to go down that route, I can move to a different specialty, which is super nice. But we're able to see, treat patients, prescribe, do small procedures, and just have that lateral ability to move to different specialties.
Also, you're still working under a doctor, correct? Like a
Yeah,
doctor
so
is the
I have a supervising physician. Each state, each specialty is different. So sometimes if you're in the OR, you'll always have the supervising physician. In dermatology, you have a supervising physician that you just go to if you need extra support, and then they also like have to read 20% of your charts.
and what is the specialty you wanna be in?
I am keeping an open mind. I do love my dermatology though. So I do want continuity of care as well as patient and family centered care, which I can get in dermatology, but I also can get that in women's health that I've been interested in, as well as like ENT, which I'm interested in. So just all I'm keeping an open mind, but I want more clinic based.
And do you want to stay where you are now, or you said you'll wanna go back to your hometown?
I live in Nevada. I actually got into school at the University of Utah. So I'm moving to St. George, Utah this April, and I'm super excited. Really, wherever it takes me, I do have a dream that I'm gonna go back to the community that raised me, and I'm gonna give back to that community because they, like, have such a near and dear thing close to my heart. It's a really tight-knit, working hard community that I just wanna go back to.
Yeah, for sure,
So
that's
maybe one day I'll go back there.
yeah, that's kinda like what people ask me because 'cause I'm going to school for dietetics, and I'm always like, "Well, you never know what could happen." I mean, I wanna live out of state, but I feel that is such a hard thing because once you get into your program, you get opportunities and you're pulled in so many different ways, just kinda like how you said, like, you wanna do this particular focus, but things could happen, changes could happen. So
Yeah, so after PA school, I'll know more hopefully, but I'll know exactly what specialty I'll wanna go into.
in going into PA school, I have heard so many people say it is a very hard, it's very competitive. I was at the hospital a couple months ago and there was a girl that was there and she was actually in one of my classes because my undergrad was with doctors and surgeons. And I asked this girl, I was like, "Oh, you're a nurse now?" She was like, "No." Well, I am, but right now I've applied to PA school 3 times and I didn't get in. So, how was your process?
Yeah, it's a grueling process, honestly. So there's so many prereqs and things you have to check off the box. So on my application, it was 34 pages long.
My gosh.
So you want to get as many volunteer hours, as many leadership hours. They want to see that you're well-rounded per
Right.
se. And how much you're working, and you also have to work at least 2,000 hours of clinical hours, so that's direct patient care. So I'm a medical assistant. I room the patient, I scribe for my provider, and then I discharge them, and then I deal with all of their medication refills, all the skin cancer results. So you have to get clinical hours, then you have a big personal statement that everyone reads 8 million times, has everything to say about it. So you really have to choose of like how you want to portray yourself. So I submitted on end of May, and then I applied to 8 schools. This is my first time applying. So I applied to 8 schools. I was ghosted by 6 of them, denied by 6 of them. And then I got an interview at the University of Nevada, Reno, which is where I currently live, and at the University of Utah. They were actually 3 days apart. And also at that time, my dad was going through cancer treatment. So
My
it
gosh.
was just a big, long, stressful month. But I was able to talk with the admissions board and
Advisor?
interview myself and prove myself. And both interviews were about 8 hours long.
Oh my gosh.
Yeah, and then, a few days later, about a week later, I got the news from UNR. I was waitlisted from the University of Nevada, Reno, so I'm kind of just in limbo with them, and then I got accepted to University of Utah, and I've decided that's where I'm going. Even if I get into UNR, I really liked the mission, vision, and how welcoming University of Utah was. So I've kind of more resonated with them and kind of fell in love with that school, that program, and everything.
That's so awesome. Congratulations. Congratulations. Okay, me editing it now. I just want to say my little congratulations is not enough. Kelly, congratulations. That is freaking amazing. Like you did something that so many people cannot achieve. So here's a better congratulations. Congratulations, sister.
Thank you. University of Utah only accepts 3% of applicants. And then I did the math because I was curious, and 0.09% are out of state. Like, yeah, it was shocking that I got in the first time. it's
I mean, your
still
hard work paid off though, but like that's really cool because I know a couple people who have applied and they're like, yeah, I'm done. And it's not to say that they didn't work hard, but they're like, I'm not applying anymore. This is ridiculous. And the fact that you got in and you went through all that stuff, like that's stressful.
yeah, so I'm excited, and honestly, the lessons I've learned coming out is just don't compare yourself. I There's so many Facebook groups of, like, PA or pre-PAs and showing their stats of GPA, science GPA, all the leadership, and people had higher than me and people had lower than me, and people that higher than me didn't get in, and people lower than me got in, or vice versa. It really is just don't compare yourself. They're not just looking at grades, they're looking at yourself individually as well as your interview process. I think that really showed them that as a little person, I know my like scope and I know what I can do, and this is why I'm here and this is why I want to do it. So just don't compare yourself. I didn't want to hear that doing it, but honestly, like now I'm like, yeah, they were right. Don't compare yourself.
Gwen here. I just want to say sometimes the world doesn't feel like it was built for us in mind. It's easy to think that others will have more access or more opportunities to something because they have more of a quote unquote advantage. But stories like this remind us that progress doesn't come from waiting for spaces, it comes from taking the space up.
And with the University of Utah, they asked me, like, harder questions, and then they, told me, like, it is important to have little people in healthcare or people have a disability in healthcare. They first asked me hard questions of, "When have you ever been in a surgical case? How are you gonna do the surgery rotation?" And I had to be completely honest with them and say, which I have scrubbed in for a surgery just as a shadow, so I
Uh-huh.
couldn't touch the patient, but it
Yeah,
was actually breast oncology, and normally when somebody has a breast cancer, it's on the lateral side, which is more towards the armpit. So I was able to see and looking at it, I'm like, "I can do that." And so it was honestly opening the eyes of the interviewer of if you give me a surgery that I can do, that is maybe not medial, like, I'm going into, like, the heart per se or, like, into the stomach or anything like that where I can't reach, the interviewers, even said, "Oh, you could do hand surgery. The hand surgeon always sits down during surgery." Exactly. I was able to prove my point within that, and I was able to do a surgery rotation. I might not, again, give the best quality of care in that, but I'm gonna put my best foot forward and be knowledgeable in surgery, but maybe not do everything. But I also don't want to be a surgery PA.
for sure.
I don't. Maybe I'll find a love for it, but right now, I think clinical is my best work, and that goes to show even with parents who are expecting a child with a disability, I think it just gives them a relief or even just knowing friends, family members, and caregivers just to see a different perspective, and as well as patients, if a patient got a diagnosis that is life changing. I just want them to know that they're heard and they're listened to. And I want them to know that they too can like chase their dreams. It might not be the same road that they've taken and it might not be the same even profession, but there'll always be something that you want to do and something will mix of where it'll connect. So just like me wanting to be a nurse, realized that's not where my quality of care was, so I went to PA.
Yeah. And I think that's such an important point too. Let's just say, for example, you see a mom and she's pregnant and she is in her baby is diagnosed with dwarfism and she's all worried and unsure of like, is my kid gonna make it? And seeing you thriving, doing it, and not letting that stop you, I think that will inspire other people and see them like, oh yeah, I can do it too. But I also have heard as well, like people are more inclined to seek out healthcare when they see other people like them.
Yeah, definitely. So I'm excited, and I'm excited to find them the resources. I know some even average height providers might not know of as many resources as we do, but knowing that I have Little People of America, I'm sure I can find something if a patient has one limb or Down syndrome, groups like that. Because it's not just medical health care. It's also social health care. Mental health is huge too. So I want to be able to cover all bases of that. I think representation matters because it also brings in the fact that people with disabilities or are real people and we are need to work, and there are many patients who I've had that they have either white coat syndrome and then seeing me kind of they have a reservation. So going in, I've had one patient said, "What makes you capable of doing this?" And you kind of almost have to put yourself in their shoes in case they do have white coat syndrome and they're scared of doctors. So I have to go about it in a different way of explaining who I am, what my qualifications are, and how I've done this before. He came in for a suture removal and it wasn't my patient, but my manager asked me to do it. So I called him back and he asked me what makes me qualified to do this. So I had to kind of take a step back and realize that I'm not his normal provider. He's never seen me before. And I explained what I'm gonna be doing, and I even had my provider that I worked for come in because I saw the reservation on his face, and sometimes you just have to make the patient comfortable, and then the next time he saw me, he was actually moved to our clinic, and at that point, all reservations were down.
Do you think he was saying that because of you being little?
I don't know, cause he's also had many other medical assistants. Had a suture removal before. I don't wanna assume of why he was, but I just know that it might be. If it is, I have to still see the patient, so I have to make my adjustments when talking to a patient. Dealing with the general public, you're dealing with so many people, so many different communication styles, so many different personalities, so just kind of going with the flow of what they want.
And have you had any patients kind of disregard you because of your size?
No, some patients have said some comments, but kind of have to just brush it off. I know that's gonna be my life, so I'm rolling with it, but most of my patients, they love me for who I am. They are excited to see me. They know what I'm capable of, and they know I give good work too. They have expressed so many times of I've gone above and beyond, and that's what I wanna do as a medical assistant and even as a provider, just to make sure that they are an advocate for their care as well as I'm advocating for them.
What you're doing, you're proving them wrong. Like, oh, you call me this? Like, okay, cool. Like, that doesn't define me because clearly here I am right now.
Yeah, just going into my patients who I have very near and dear to my heart, I'm able to now tell them that I got into school. They've come in waiting to hear if I've gotten into school. They've asked me between the time I submitted and October, we weren't hearing anything, and just watching how bummed the patients were, and then the quick turnaround of 2 interviews back to back, wait list, accepted, and now being able to tell them that I got in is a super cool and rewarding feeling, and them being like, "You have to come back." So,
And it shows like you are like I'm sure this is how you want once you become a PA, this is how you want to do it too. Like you're leaving these patients with such good memories of you, but also happy. Like sometimes when people go to the doctors, I mean a lot of times generally people don't like it because the stereotype of it doesn't make me feel good. There's no like none of it's good, but like you go there and these patients come feeling better after because they get to talk to Kelly.
yeah, and so I'm definitely the loudest in one of our offices, and so but I love my office, and also everyone in my office has been nothing short of amazing. They have supported me. My provider, who I worked for 3 years, has been a true advocate for me. When I started working for him, he again had his reservations of how are we going to do this, but he has taken the time to find me gloves that fit, find how things are going to work, and be able to do things with me. He stands out as good 6'3". So working with him what was a challenge, but we were both up for the challenge and we had to find those ways, and we almost had to be uncomfortable to find the comfortability. So we just had to work through the kinks.
Say the accommodations you've had, because I know for a while, I mean, it's not really like it anymore, but I know for a while when I was younger, like I always hated sticking out. So when you had these accommodations, when you started working in PA school, was doing these accommodations hard? Like, this sucks having to do something that not everyone else has.
The step stools per se in the clinic, I'm like, yeah, they're here. So so too, like, it's nice for patients. They use them too to get up on our very high, very old clinic chair. I think working through being the uncomfortable of learning how we're gonna do biopsies together, it was a little harder and a little more frustrating of like, take a deep breath, we're gonna figure it out, we have to. So, but again, after that, we've gotten it fixed. And he also has another medical assistant who's the same height as me. So sometimes when I have a hard time, he's just like, you can go get the other medical assistant, and that's what they're there for. That's what a team is. And I think that's like the great part of being a PA is like you have those team members to rely on. So hypothetically, I'm not able to do something or I'm not being able to give my best quality of care. I know that I can rely on my medical assistants, the other PAs around me, as well as even doing a patient care treatment plan. I think just bouncing off ideas and figuring it out with others is great.
And would you say that, I mean, yes, you always kind of wanted to be in this field, but seeing you now, like, did you think you would be where you are?
No, and I honestly, it has barely setting in that I got into PA school. Unfortunately, I am hard on myself as anybody is, and so going into my first cycle, I was like, "I don't know if I'm gonna get in." So even if you asked Kelly 6 months ago, I didn't think I'd be able to do it. But I know but you also have to be confident in the work you put in, and that's again going back to don't compare yourself. You've done all of these things. You've put your heart into school. Be confident with it. Trust little Kelly's.
In the last question, I always ask my interviewers or my guests are, if there was one thing you wanted to leave the listeners with, or one big overarching message, what would it be?
I think that I would want to say is be confident in the work you've done. You've already made it to this point. Don't compare yourself and just trust the process because the process will get you there. It might not be the road that you intended. Mine was not, but I think everything happens for a reason too. And with that, I got to the place I wanted to. I didn't even get into school where I'm an alum at, but I got into a school that really trusted me and valued me, and I'm excited to help prove of why they chose me to.
I love that reminder, trusting the process even when it doesn't look the way you planned, because I think so many times, even with me, I have such a hard time, like, okay, this is taking a bit longer, or this is not going exactly how I planned, but like, there's a reason for everything and you just got to trust the process. So, Kelly, thank you so much for coming on today's episode and being so open about your journey into PA school. Your story is such a powerful reminder that the right path will find you when you keep showing up and believing in yourself. I just want to say, when I saw that picture of I think it was one of your parents posted the picture of you going to PA school, I was like, oh my gosh, I have to get my girl on. So thank you all so much. So thank you, and thank you all so much for listening. Make sure to like and subscribe for more episodes, and we'll see you guys next time. Bye.